Doctors are shocked. This vegetable raises stroke risk overnight. Senior health for individuals who have surpassed their 60th birthday. The notion of a healthy evening meal, perhaps a crisp salad or a serving of steamed vegetables, often brings a sense of accomplishment and pride in making wise dietary choices. However, a concerning reality exists where, upon waking, subtle yet alarming changes can manifest. A slight slurring of speech, a perceptible weakness in an arm, or an unexpected bout of dizziness. While commonly attributed to excessive consumption of fried foods or sugary treats, the precipitating factor can, surprisingly, be a vegetable previously perceived as a dietary guardian. Yes, a vegetable, one that has long been heralded for its heart-healthy and brain-boosting properties, can, after the age of 60, subtly and insidiously elevate the risk of a stroke, often without any discernible warning signs during the night. This phenomenon has been observed with an unsettling frequency in clinical practice, highlighting a critical shift in how our bodies process sustenance as we age. Foods that once served as allies in our 40s can, by our 70s, become potential adversaries, particularly when interacting with common medications or when consumed at suboptimal times of the day. The reassuring news, however, is that the answer does not lie in food restriction, but in a deeper understanding of how an aging physiology metabolizes nutrients differently. This exploration aims to illuminate 9 prevalent vegetables that, for those over 60, can quietly amplify stroke risk, and more importantly, to equip you with the knowledge to continue enjoying them safely. Pay close attention, as the final vegetable discussed is a staple in the diets of many seniors, and its potential for harm may be the most significant of all. We begin with a vegetable that has historically been considered a steadfast ally, yet after the age of 60 can covertly transform into a hidden threat to cognitive well-being. Vegetable number 9 is spinach. For many decades, spinach has been lauded as one of the Earth's most nourishing foods, a treasure trove of iron, magnesium, and potent antioxidants. However, post-60, this nutritional powerhouse can subtly transition from friend to foe if not consumed with appropriate consideration. The root of this concern lies in oxalates, naturally occurring compounds within spinach that possess an affinity for calcium. In younger individuals, the kidneys efficiently process and eliminate these oxalates. Yet as we age, renal function tends to diminish, blood vessels can lose some of their elasticity, and it is common for seniors to be taking calcium or vitamin D supplements. The confluence of these factors can facilitate the formation of minuscule calcium oxalate crystals within the bloodstream. Over time, these crystals have the potential to aggregate and constrict the delicate arterial pathways that supply blood to the brain, akin to fine sand gradually impeding the flow through a narrow pipe. This compromised blood flow leads to a reduction in oxygenation, and a minor clot can then precipitate a silent stroke, often occurring during sleep. It is crucial to understand that this does not render spinach inherently detrimental. Rather, it signifies that the body's processing capabilities for this vegetable change significantly after the age of 60. To mitigate this risk, it is advisable to consume spinach earlier in the day, during breakfast or lunch, when the body's metabolic processes are more robust. It is also prudent to avoid frequent pairings with calcium or vitamin D supplements, and to consult with a healthcare provider if you have pre-existing kidney or cardiac conditions. Spinach remains an exceptional source of nutrients, but after 60, its consumption warrants specific guidelines. Adhering to these guidelines can ensure its continued benefit, while disregard may inadvertently compromise brain health during your resting hours. Moving on to vegetable number 8, broccoli. For an extensive period, broccoli has been celebrated as a champion of cardiovascular health, a rich source of dietary fiber, antioxidants, and essential vitamins that bolster the immune system and promote longevity. However, beyond the age of 60, Broccoli can introduce an element of risk, not due to the vegetable itself, but rather its potential interactions with commonly prescribed medications. The primary concern revolves around vitamin K, a nutrient vital for proper blood coagulation. While beneficial in youth, for seniors who are on anticoagulant medications such as warfarin, Plavix, or even aspirin, an excessive intake of vitamin K can disrupt the efficacy of these drugs, potentially rendering the blood either excessively thick or dangerously thin. This delicate equilibrium can be the decisive factor between stable circulation and the occurrence of a stroke. The true danger is amplified by inconsistency. Consuming large quantities of broccoli one week and abstaining entirely the next can destabilize medication levels without one's immediate awareness. Symptoms may only become apparent when blood pressure escalates or the blood becomes too attenuated to clot effectively. To navigate this safely, maintaining a consistent intake of broccoli rather than fluctuating drastically is paramount. Complete abstinence is not necessary, but abrupt changes in consumption patterns should be avoided. Furthermore, it is imperative to keep your physician fully informed about your regular dietary habits to allow for appropriate and safe adjustments to your medication regimen. Broccoli can continue to be a powerful ally for your heart and brain health, but after 60, it demands a mindful and balanced approach. A degree of dietary regularity can significantly contribute to maintaining steady and robust circulation and overall well-being. Consider vegetable number 7, romaine lettuce. For a considerable portion of the senior population, a light salad at dinner represents an ideal health-conscious choice. Low in calories, easy to digest, and gentle on the cardiovascular system. Yet, a less recognized risk associated with romaine lettuce, particularly when consumed late in the evening, is its potential to subtly elevate stroke risk overnight. The underlying mechanism is that romaine lettuce functions as a natural diuretic, prompting the body to excrete excess fluid. While this effect is largely inconsequential in younger adults, after the age of 60, the kidneys operate with reduced efficiency. Blood vessels may exhibit increased rigidity, and the body's signals for thirst can become attenuated. Consequently, one might not perceive a state of dehydration, yet the blood can become progressively thicker during sleep. This thickened blood circulates less effectively through aging arteries, thereby creating a more conducive environment for the formation of small clots, especially when compounded by medications for blood pressure or other diuretics. The effective solution is not to eliminate salads from your diet, but to be strategic about their timing. Enjoy your romaine lettuce at lunch or earlier in the day when your body's hydration levels and circulatory function are at their peak. Should you opt for greens in the evening, consider accompanying them with a small glass of water to assist in maintaining adequate blood flow. Romaine lettuce can continue to be a valuable contributor to cardiovascular and digestive well-being, but after 60, the timing of its consumption becomes a critical factor. When eaten at an inopportune time, it may inadvertently place undue strain on your brain and circulatory system. Conversely, when consumed appropriately, it retains its status as a crisp, refreshing, and beneficial component of your diet. Let us turn our attention to vegetable number 6, raw carrots. Carrots are widely recognized as a supremely healthy snack option, offering a satisfying crunch, a low caloric count, and a rich supply of beta-carotene, which is highly beneficial for ocular health. However, for older adults, particularly those past their 60th birthday, the consumption of raw carrots at an inopportune moment can subtly disrupt circulation and compromise brain function. The reason behind this lies in the rapid digestion of raw carrots, which leads to a swift release of natural sugars into the bloodstream. While younger individuals' bodies efficiently manage these glycemic surges, seniors, especially those with prediabetes, diabetes, or a slower metabolic rate, may experience a pronounced blood sugar spike followed by a subsequent drop during sleep. This overnight glycemic fluctuation can trigger the release of stress hormones such as cortisol and adrenaline, leading to the constriction of blood vessels and an elevation in blood pressure at a time when the body should be in a state of rest. When this hormonal Response is combined with mild dehydration, the blood viscosity increases, creating an ideal scenario for the formation of small clots that can impede blood flow to the brain. The remedy is elegantly simple. Avoid consuming raw carrots in isolation or late at night. Instead, enjoy them earlier in the day and pair them with a source of protein or healthy fats, such as hummus, nuts, or yogurt. This strategy effectively slows the absorption of sugars and helps to stabilize energy levels. Carrots remain an exceptional source of vitamins and antioxidants. The key insight for those over 60 is that even wholesome foods require mindful timing and a balanced approach. Carrots consumed during the day contribute to health, while their consumption at night may quietly exert a detrimental effect. If you are finding this information beneficial, we encourage you to show your support by liking this video, as it significantly aids in disseminating these vital health insights to a broader senior audience. Furthermore, subscribing to Senior Vital Health will ensure you receive a regular stream of content designed to foster strength, clarity, and independence. We also invite you to engage with us in the comments section below, sharing your age, your viewing location, and an update on your health status. Your personal narratives are deeply valued, and each comment is carefully reviewed. We now delve into vegetable number 5, garlic. Throughout history, garlic has been revered as one of nature's most potent remedies, renowned for its ability to lower blood pressure, support cardiovascular health, and fortify the immune system. However, for individuals over the age of 60, particularly those undergoing treatment with blood-thinning medications, garlic can inadvertently cross the threshold from a protective agent to a source of potential danger. The rationale behind this lies in garlic's inherent anticoagulant properties. It contains allicin and various sulfur compounds that reduce blood clotting and promote unimpeded blood flow. This effect is generally beneficial unless one is already taking prescription blood thinners, such as warfarin, clopidogrel, or even a daily dose of aspirin. When combined, these agents can render the blood excessively thin, leaving the delicate blood vessels within the brain susceptible to bleeding. The consequences can range from dizziness and bruising to nosebleeds, and in more severe instances, a hemorrhagic stroke. The appropriate course of action is not to forego garlic entirely, but to integrate it judiciously. It is advisable to eschew concentrated garlic supplements unless explicitly approved by your physician, and instead to limit its use to modest quantities within cooked dishes. The process of cooking attenuates garlic's blood-thinning potency and enhances its digestibility. Vigilance for early indicators of excessively thin blood, such as unusual bruising, persistent headaches, or fatigue, is essential, and any such observations should be discussed with your doctor for potential adjustments. Garlic remains a truly remarkable gift from nature. However, after 60, it should be treated with the same care and consideration as any medicinal substance. When utilized correctly, it bolsters cardiac function. When consumed without due diligence, it can silently jeopardize brain health. Let us examine vegetable number 4, onions. Onions are a rich repository of antioxidants and compounds that promote cardiovascular well-being, contributing to lower cholesterol levels, combating inflammation, and even enhancing blood circulation. Nevertheless, for seniors over 60, particularly those managing their blood pressure or taking anticoagulant medications, onions can introduce subtle complications if consumed in substantial quantities or at inappropriate times of the day. The underlying factor is a compound known as quercetin, which naturally promotes vasodilation, thereby lowering blood pressure. While beneficial in moderation, it can become problematic when combined with prescription medications that exert a similar effect. For older adults, this synergistic action can lead to an excessive drop in blood pressure, impairing oxygen delivery to the brain and increasing the likelihood of dizziness, fatigue, or confusion. During the nighttime hours, when hydration naturally decreases and blood flow decelerates, this combination of factors can create a precarious situation, potentially leading to a mild stroke or a fainting episode. To maintain safety, it is recommended to incorporate onions as a flavoring agent rather than a primary component of meals. Cooking onions, as opposed to consuming them raw, effectively reduces the potency of quercetin. It is also advisable to avoid large meals heavily reliant on onions in the evening when circulatory function is naturally at its lowest ebb. Maintaining adequate hydration throughout the day is equally important. If you are currently on medication for blood pressure or circulation, it is crucial to discuss your onion intake with your healthcare provider, as even minor dietary adjustments can yield significant positive outcomes. Onions remain an invaluable addition to a healthful diet, but after the age of 60, their consumption necessitates prudence and balance. A modest quantity enhances flavor and offers protection, whereas excessive intake at the wrong time can subtly compromise brain and circulatory health. We arrive at vegetable number 3, corn. For a substantial segment of the senior population, corn evokes a sense of comfort and familiarity, whether as corn on the cob, a comforting bowl of grits, or a warming spoonful of corn soup. Its presence is often associated with tradition, warmth, and an inherent sense of harmlessness. However, a critical nutritional distinction that many overlook is that corn, from a physiological perspective, functions more akin to a starch than a typical vegetable, and this difference carries significant weight after the age of 60. Upon ingestion, the body rapidly converts the natural sugars present in corn into glucose, precipitating a surge in blood sugar levels, a response comparable to consuming refined white bread. For seniors who experience a diminished insulin response or possess compromised circulation, this glycemic roller coaster can subtly elevate the risk of stroke and strain on the cardiovascular system. The cycles of blood sugar spikes followed by precipitous drops prompt the body to release stress hormones, such as cortisol and adrenaline, leading to the constriction of blood vessels, an increase in blood viscosity, and the creation of an environment conducive to clot formation during sleep. The solution, therefore, does not mandate the complete elimination of corn from one's diet, but rather a more intelligent approach to its consumption. It is advisable to refrain from eating corn in the evening, when the body's metabolic rate is reduced and hydration levels are naturally lower. Pairing corn with protein or healthy fats, such as eggs, avocado, or beans, can significantly slow down the absorption of sugars. Furthermore, it is prudent to treat corn as an occasional side dish rather than a daily dietary staple. Fresh corn on the cob is generally preferable to processed forms like cornflakes or cornmeal, which are digested more rapidly and elicit a more pronounced sugar spike. While corn may possess a simple and sweet taste, it is imperative to recognize that after the age of 60, the body processes it differently. With careful management and an appropriate balance, it can still be enjoyed, albeit with considerations regarding frequency and timing. Proceeding to vegetable number 2, asparagus. Asparagus is often characterized as a clean vegetable, perceived as light, elegant, and a favored component of health-conscious meal plans. However, for individuals beyond their 60th year, this sophisticated accompaniment can, if consumed at an inopportune time of day, subtly jeopardize circulatory health. The reason for this lies in asparagus's natural diuretic properties, which stimulate the body to eliminate excess fluid. While this effect is generally innocuous in younger adults, for seniors, it can contribute to nocturnal dehydration, resulting in thicker blood and diminished circulation, particularly when combined with medications for blood pressure or other diuretic agents. The consequence of thicker blood is a sluggish flow through aging arteries, thereby increasing the likelihood of small clot formation that can obstruct oxygen delivery to the brain during sleep. The corrective measure is straightforward. Avoid consuming asparagus late in the evening. Instead, opt for enjoying it at lunch or in the early evening, when you are still actively hydrating and engaged in daily activities. Accompanying asparagus with water or hydrating foods such as cucumbers or melon is also recommended. If you are receiving medication for blood pressure or kidney-related conditions, it is advisable to consult with your physician regarding whether asparagus might amplify the effects of these treatments. Asparagus remains a valuable source of vitamins and antioxidants that contribute to the health of the heart and skin. However, akin to many other foods, its consumption after the age of 60 necessitates careful attention to timing and balance. By consuming it earlier in the day and ensuring adequate hydration, you can harness its benefits while mitigating any potential hidden risks that may arise during the night. Finally, we examine vegetable number 1, tomatoes. Tomatoes are frequently regarded as an emblem of healthful eating, perceived as light, refreshing, and abundant in antioxidants. However, for individuals past 60, this culinary staple can subtly contribute to circulatory issues that bear a resemblance to stroke symptoms. Tomatoes belong to the nightshade family, which contains compounds such as histamines, tyramines, and solanine. These substances can instigate inflammation, cause unpredictable constriction or dilation of blood vessels, and interfere with neural signaling. In aging brains and blood vessels, which are inherently more fragile, these effects can manifest as dizziness, headaches, or numbness that eerily mimics the early indicators of a stroke. The inherent acidity of tomatoes can also disrupt electrolyte balance, leading to a depletion of calcium and magnesium, minerals that are essential for stable nerve and muscle function. When consumed in significant quantities, particularly in the evening, this can result in fluctuations in blood pressure and impaired circulation during sleep. This does not necessitate the complete abandonment of tomatoes from your diet. Gentle cooking can help to reduce solanine levels and enhance the bioavailability of antioxidants like lycopene. It is advisable to avoid heavy tomato-based meals before bedtime and to opt for earlier consumption during the day. Pairing tomatoes with magnesium-rich foods, such as pumpkin seeds or spinach, can help to counterbalance their acidity. Tomatoes continue to be a valuable source of heart-protective nutrients, but after the age of 60, their consumption requires moderation, mindful timing, and a conscious effort to listen to your body's signals. By enjoying them judiciously, they will remain a beneficial ally rather than an unintended trigger. Having been apprised of the potential hidden risks associated with these 9 vegetables, it is understandable to experience surprise and perhaps a degree of apprehension. Throughout our lives, we have been consistently informed that vegetables are invariably beneficial. While this is largely accurate, it is crucial to acknowledge that after the age of 60, the body undergoes significant physiological changes. Kidney filtration slows, blood vessels become more delicate and prone to fragility, and hydration requirements shift considerably. Even foods that are universally recognized for their healthfulness can behave differently within an aging physiological system. The focus, therefore, expands beyond mere ingredient selection to encompass not only what we consume, but also the optimal timing of meals, the quantity consumed, and any concurrent intake of medications or supplements. A salad enjoyed at lunchtime might offer salutary effects, whereas the same salad consumed in the evening could inadvertently lead to blood thickening or an excessive drop in blood pressure. Similarly, garlic, when properly cooked, can contribute to cardiac health, but garlic supplements, when combined with certain medications, can dangerously thin the blood. Timing, balance, and a heightened sense of awareness emerge as the true cornerstones of longevity. The empowering truth is that you are not without agency. The more profound your understanding of your body's unique processes, the greater your capacity to exert control over your health. By implementing small, deliberate adjustments, such as ensuring adequate hydration, modifying meal schedules, and being mindful of potential medication interactions, you can continue to savor your favorite foods without undue concern. Ultimately, knowledge does not equate to restriction, but rather to liberation and empowerment. This presentation is intended for informational and educational purposes exclusively and should not be construed as a substitute for professional medical guidance. Every individual's health circumstances are unique, particularly when managing chronic conditions or undergoing treatment with prescription medications. it is imperative to consult with your physician or healthcare provider before making any substantial alterations to your diet or adjusting your supplement regimen. Prioritizing open communication with your doctor and actively listening to your body are the most prudent pathways toward achieving sustained long-term health. Today, we have unveiled 9 common vegetables that, when consumed improperly, can subtly elevate the risk of stroke. From spinach and broccoli to tomatoes and asparagus, these foods, when approached with the right timing, moderation, and an awareness of your individual medication profile and hydration status, can continue to safeguard your brain and fortify your body. Now, we invite you to share your thoughts. Which of these vegetables has surprised you the most? And do you intend to modify your consumption habits based on this information? Please share your perspectives in the comments section below. Your experiences may offer valuable insights to other viewers. If you have found this video to be informative, we kindly request that you like it, subscribe to Senior Vital Health for ongoing content, and consider utilizing the Super Thanks feature to support our mission of empowering seniors to live strong, informed, and independent lives. Remember, the nutritional choices you make today lay the foundation for the clarity, strength, and independence you will experience tomorrow. Remain sharp, stay safe, and embrace vitality, for aging is not an inevitable decline, but an opportunity for continued growth and well-being.